يلا يا محمد انا
Scenario
لانه ما
50.
Okay, I will not be monitoring the time or what did he miss. You should do that.
Yeah.
Okay.
A 55-year-old man present with unsteadiness and altered speech. You are asked to perform a neurological examination focused on the cerebellum and cranial nerve. Task: perform a focused cerebellar and lower cranial nerve examination on this patient. You have 6 minutes for examination, 3 minutes for discussion. Let me put the timer.
Okay.
Fatah Rahman, can you meanwhile call Ahmed please and Hassan for us because we cannot call because of the call of the Zoom.
Sure.
Okay.
Okay, 6 minutes started.
Hello, my name is Dr. Fad Ahmed, one of the surgical doctor here. May I confirm your name and age, please?
Hi doctor, my name is John. I'm 55-year-old.
Glad to see you, Mr. John. Today I'm going to examine your part of brain known as cerebellum. This may involve me looking, feel, and do a special test. Is that okay with you?
Yeah, that's fine, doctor.
Do you need a chaperone?
No, I'm okay.
Okay. Okay, Mr. John, I will start by asking you, give me some steps. Can you walk to the end of the room?
Yeah, I can walk now. You want me to go to the end of the room and come back?
Yeah.
Yes.
Just, Mr. John, can you walk a hill on two steps?
Can I what? Sorry.
Could you walk on hill step?
On hills. Okay. Yeah. I'm walking on hills now.
Okay, thank you. I will be beside you. Don't worry.
Yeah, fine.
Okay, thank you. Mr. John, I want you to close your eye, to stand up and close your eye. Sorry again.
Yes.
And put your arm beside your body, both arms.
Put them beside what?
Stand
like
your
this?
arm. No, stand. Put your arm like this.
Okay.
This.
Yeah.
And close your eye. I will be beside you.
Yes.
Close your eye now.
Yes.
Okay. Thank you, Mr. John. Thank you. Mr. John, can you sit, please?
Yes.
Yes, Mr. John, can you say, could you say British Constitution?
British Constitution.
Continuously, British Constitution?
British Constitution, British Constitution,
Thank
British
you.
Constitution.
Thank you. Mr. John, now I want to examine your eye. Is that okay with you?
Yeah, that's fine, yeah.
Okay, can you follow my eye? My finger?
Yes.
Okay. Please focus on my wall behind me, okay?
Okay.
Now I will move your finger and look to the point behind me.
Yeah.
Okay, now?
Yeah.
Okay, thank you. Mr. John, now I want you to do some other special tests. Is that okay?
Yeah, that's fine.
Okay. Mr. John, I need you to open your mouth. Say ah.
Ah.
Okay, protrude your tongue and move it side to side. Shrug your shoulder. Thank you very much. Okay, Mr. John, now I want you to extend your arm. Your palm face up. Okay. Now I'm going to press on your arm. I will protect your head. Don't worry. Okay. Okay. Thank you. Now I want you to do this movement like this. Okay. Thank you, Mr. John. Mr. John, now I want you. I want you to grab this pencil from the table. Okay, yeah. Thank you very much. Mr. John, now I'm going to ask to tap in your elbow and your wrist. Okay. By using this hammer, I will be gentle with you. Okay.
Yeah.
Okay. Thank you very much. Now, can you give me your hand? Now I want to examine your movement and your tongue. the wrist. I will start by the wrist. Keep relaxed, please. Your
Okay.
elbow, and your elbow. Thank you very much. Thank you very much. Mr. John, now I'm going to examine your lower limb. Is that okay with you?
Yeah, that's fine.
Can you lie flat? On your bed,
Yeah.
couch? Thank you. Now I'm going to roll your upper limb, your lower limb. Okay. Keep relaxed.
Imagine this, my lower limbs, yeah?
Okay. Okay, thank you. Now Mr. John, I'm going to lift your lower limb. Okay. I will be gentle. Thank you very much. Now, can you bend your leg, both your leg together?
Yeah.
Can you push on me? Push at me? Push
Yes,
on me.
I'm pushing now, doctor.
Now, thank you. And I'm going to pull your leg, your both leg. Can you resist me?
Yes.
Okay, thank you. Now, Mr. John, can you put your heel on your chin by using your right hand, your right lower limb, and move it? The other one.
Yes.
Thank you. Thank you very much. Now I'm going to tap by this hammer in your knee and your ankle from behind. Okay.
Okay.
Keep relaxed. I will hold up your both knee. Okay. Thank you very much. Now, Mr. John, I want to do keep relaxed. I want to show your tone in the ankle. Okay.
You wanna do what, sorry?
I want to examine your ankle for the tone.
Okay.
Time up. Could you please present your case?
I did the cerebellar examination in Mr. John, 55 years old, 53 years old, who presented with abnormal speech. I found abnormal speech and abnormal gait. I found the patient, Mr. John, with dyskinesia and intention tremor, and also with nystagmus and nystagmus and intention tremor and staccato speech and hypotonia. My provisional diagnosis is cerebellar ataxia due to posterior fossa tumor.
What are your other differential diagnoses?
I will consider stroke and multiple sclerosis and TIA and other brain tumor.
Okay. Can you name type of posterior fossa tumors? 3 or 4?
Okay. Astrocytoma, choronoid plexus tumor, and epidymoma, and epidymoma and Hemangioblastoma.
Hemangioblastoma. Okay. And what investigation would you request?
By image investigation, I will start by MRI with gadolinium and CT brain and CT whole body and guided biopsy, stereotactic biopsy.
And how would you manage this patient?
After taking full history and do full clinical examination, I will discuss this patient in MDT for operable tumor. I will go for resection by stereotactic and non-operable for stereotactic radiosurgery and plus or minus chemo and radiotherapy.
What do you like to consider beside this treatment?
Besides this treatment,
any medication you would like to give to your patient?
Yes, I will give him steroid to decrease cerebral edema.
Okay. The last question this session.
And also I would like to add anticonvulsant also.
Okay. You have 20 seconds. So Al-Fatih, very nice. Let us review from the beginning. Okay. Very nice presentation, Al-Fatih. You start by check the gait. I'm so happy that you say to your patient that I will be beside you in case if you need me. And regarding Romberg sign.
Okay.
What did you do regarding wronging sign?
I asked the patient to stand up and put his arm on his body on his sides, extending, and
Yes, you
ask
should.
him to close his eye.
Yeah, and you should say I will be beside you
Yeah,
in case if you need me.
yeah.
You mentioned the staccato speech,
Mhm.
and for upper limbs, you need just to do reflex for the elbow. I saw you did two reflex, I think, in front and behind.
Okay, just
Or
elbow.
yes, for elbow, for yes, trapezius
Okay.
muscle.
Okay.
And regarding the movement, the pronator drift and rebound phenomena,
Mm.
how you can demonstrate it, please?
Brunette drift, I asked the patient to extend his arm and we're facing the palm up.
While
like this.
closing his eyes.
While closing his eyes, yes.
Yes. And regarding rebound phenomena?
In the same position, after notice the patient, you are going to press on the limb, upper limb.
Did you say that to Ali?
Yes, yes. I said I will protect his face.
I think you asked him while standing, but you can do it while patient standing or sitting.
Okay.
And you mentioned that the adukinesia and intention tremor perfect. And the lower limb, you did the muscle tone, the patellar and Achilles reflex, but the time didn't allow you to do the heel to shin coordination.
He did.
Heel to shin coordination, did you do it?
Heel to shin, yes, he did it.
Okay, otherwise you check the cranial nerve, but you forget also to tell your patient, can you turn your head to each side against my hand? You said the shrug shoulder against my hand.
No,
But
just
add this. Otherwise, regarding the discussion, you mastered the discussion. You answered all questions correctly. And regarding the how you manage this patient, you add later on the steroid and anti-epileptic transfusion. Otherwise, I have no points. Very nice presentation. This is the difficult session, Al-Fatih.
Yes, good Al-Fatih. Good Al-Fatih. I just want to add to one or 2 points. You know, Al-Fatih, for romper sign, you can ask your patient to sit this way, or extend his hand whilst he's closing his eyes. The 3 of them is right.
Okay.
And you should tell your patient, I will just be close to you. If you fail, I will hold you, not to fall.
Okay.
And I think the finger. Did you do this?
No.
This is the other kind.
I forget. Yeah.
Yes. So I remember that. Yeah. So you forgot that
symmetry,
one.
yeah.
So for me, you can look. I like the cerebellar. I know how we did it in the school, but for me, I just do it from top to bottom. The eyes, the nose. When I come to the mouth, the speech, and this cadukinesia and the tongue. When I come to the hand movement and the reflexes. So you can. The best approach to not to forget anything about the cerebellum is think about it anatomically. Does that make sense?
I typically follow the school steps.
Yeah.
But when I come to nose, I forget it.
Yes.
You cannot do that.
What do we call this test, Muhammad?
Finger to nose test.
Finger to nose test.
Yes. And you did this cadukinesia.
Okay.
You said look to your wall.
Look to the wall behind me.
You said to your wall.
Sorry for that. Okay.
Yes, so you look to the wall. But otherwise, I think you've done a good job. It's not an easy session. The discussion was very good. Muhammad push you to remember the steroid. On your exam, nobody gonna push you to remember. Some examiners are very nice. Some of them will act like they didn't know.
Yeah.
And one of the examiners very nice.
Yes. Let's move to the next, Muhammad.
Should we move to the next? Yeah.
Yes.
Okay. Yes. The next session is cranial nerve examination, the most serious one. So, Ahmed Fath Rahman, who will take this station?
Okay.
Ahmed, are you ready?
Yes.
Okay. Please
Just a
open
second.
your formula.
It's very difficult station. I can be the patient for you if you don't have anyone.
No, I have a patient.
Okay.
Very
Even
nice.
better. Let's start.
A second.
Muhammad, can you reply to his answer with the simulator?
Okay. Everyone bin Ahmed, please. Ahmed Sugi. Bin. Put him in the sitting position, Ahmed.
Okay.
Yes. Scenario.
The camera is not that clear.
Okay. What?
The camera is not that clear. If you can.
اقفل الشباك يا
كلاس ذكرتي
عشان اللايت. اي اقفل الستاره.
You want anyone to hold the camera?
اقفل الستاره يا محمد يا احمد.
Yes. If someone can hold the camera, that would be better, of course.
Yes, good.
Okay, just a second.
Yes.
Is this clear now?
Yes, clear. Let him just closer to you and the patient.
Yes.
They can move closer to you and to the patient.
Ready? Scenario. 35 years old man is referred by his GP due to persistent headaches. You are asked to perform cranial nerve examination. You have 6 minutes for examination, 3 minutes for discussion.
Okay.
6 minutes started.
Okay. Hello, I'm Dr. Ahmed Soug. I'm a surgical doctor in here. Can you confirm your name and age, please?
Hello, doctor. My name is Jack and I am 35 years old.
Nice to meet you, Mr. Jack. Today we'll examine your cranial nerves. Okay.
Okay.
Are you happy to do this examination with me?
Yes.
Okay, Mr. Jack. Examination includes look and feel and do some special test. If you feel any pain during examination, please let me know. Okay.
Okay.
Mr. Jack, do you want any help with this examination?
No, I am okay.
Okay, Mr. Jack. So we'll start by check your smelling. Okay. Can you please close one of your nostrils by your hand like that?
Yeah, I did.
And now can you close your eyes? I will give you a object. I want you to tell me what is smell. Okay.
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 It's orange.
Okay. Now can you please can you please block your other nostrils?
Okay, I did.
And close your eye again. Okay. And
It's
this.
an orange, I think, also.
Okay. Brilliant, Mr. Jack. Okay. Now, Mr. Jack, we will move to another step. Okay. We will assess your visual acuity. Okay.
Okay.
Do you normally wear glasses, Mr. Jack?
Yes. I don't.
Okay.
No, I have no any glass. I have no any glass, doctor.
Okay, Mr. Jack. Now you are away from this whiteboard for 6 meters, I think. I want you to read this panel, please. Can you read it?
Yeah, I can. The dog in the park.
Okay, brilliant, Mr. Jack. Now, Mr. Jack, could you please focus on that wall? Okay. Now, can you look at my finger now?
Yeah, I looked it.
Do you feel any pain or blurred vision? Or double vision?
Slightly.
Oh, I'm really sorry, Mr. Jack. Now, Mr. Jack, I want to check your visual, your sensitivity to colors. Okay. This I will take this chart for check the color. What is this color?
Yeah, it is. I can't determine exactly.
And this?
L.
And this?
P.
Okay. Now, Mr. Jack, I want to do fundoscopy for you. Okay. Please.
Skip it, please.
Okay, now, Mr. Jack, we will check your eye. Could you please focus on my both fingers, and please fix your head and follow it by your eye. Okay. If you
Okay,
feel any pain or double vision, please let me know. Okay.
of course.
Okay, now. Okay. If you feel any pain or double vision, Mr.
No, no.
Okay. If you feel any pain, please let me know and stop me immediately. Okay.
Okay.
Okay. How about now?
Yeah.
Okay. Okay, nice. Brilliant, Mr. Okay, now could you please um okay, I will this is the button. I will put it in your chest. I want you to tell me what is I want you to tell me if you feel this button.
Yeah, I felt it.
Okay, now please close your eye or put it on different side in your face. You feel it? Please let me know. Okay.
Of course. I felt it, yeah. I feel it. I feel it.
Okay.
Yeah, I feel it.
Brilliant, brilliant, Mr. Okay, now could you please open your eye and look at me? Okay. Now,
Yes.
could you please elevate your upper eyelid like that?
Okay, I did.
Okay. Now, could you please close your eye tightly like that?
I did.
Okay. Open it now. Now, could you please clench your teeth?
Yes.
Okay. Could you please blow your cheek?
Yes, I blew it.
Okay. Could you please tense your neck like that? Okay. Brilliant, Mr. Jack. Now, Mr. Jack, I will check your. Could you please stop at this spot, Mr. Jack?
Yeah.
Okay. Now, Mr. Jack, I want you to close your eye and march on your spot, and I will be beside you in case you need me. Okay.
Yes, I did.
Now, could you please
Yeah, I
march?
marched. I marched. Yes, I did. I
Okay.
did.
Okay. Nice. Brilliant. Now, could you please sit? Okay. Could you please close one of this ear? Okay, I will come from this side and tell you a number. I want you to correct. Okay.
Okay. You said 9, I think.
Okay. Now from other side. 45.
45.
Okay. Nice. Now this is return 4. Okay. It will make a sound. I will put it in beside your
Time
eye.
up. Time up. Could you please present your case?
Okay. I did clinical examination for this gentleman. He had I did clinical examination for this gentleman. He had.
You can let him go now. Yeah. Thank you.
Let me put the timer again. Please unmute yourself, Ahmed.
Okay. I
From the
did clinical examination for this gentleman. He had bilateral he had bilateral bilateral loss of vision, and bilateral loss of vision most likely is by temporal hemanopia, and other cranial nerve is normal, is most likely by temporal hemanopia due to optic chiasm compression due to pituitary adenoma.
Okay, what other differential diagnosis or possible causes of chiasmal compression?
It may be transient ischemic attack, glioma, meningoblastoma, and head trauma.
And what symptoms may suggest increase intracranial pressure?
Critical pressure, persistent headache, and projectile vomiting. Persistent headache, projectile vomiting, and also projectile vomiting, and also blurred of vision and seizure.
Okay, and what symptoms may indicate hormonal dysfunction from pituitary tumor?
Hormonal dysfunction from pituitary tumor, it is acromegaly, and symptoms from the increase prolactin secretion, acromegaly, macroglossia, bruxism, and thick skin, and also thick skin, and from increased prolactin secretion, like decreased libido, impotence, and decreased libido, impotence, and galacturia, and
Okay, that's enough, doctor. What investigation would you order?
investigation. I will order MRI with gadolinium contrast and CT brain with contrast, and also I will do pituitary funnel, prolactin, ACTH, and so on.
Yeah, and what's your management?
I will manage this patient. I will do transfrontal resection and transspinal resection.
Before
and
the
also
surgery, doctor.
for surgery, conservative management for raised intracranial pressure, and also I will give this patient and dopamine agonist. And surgical, this is medical. And surgical, I will do transfrontal resection of the tumor and transfrontal resection of the tumor,
Time up.
and radiotherapy and chemotherapy.
Yeah, this is the last question. This station. Very nice, Ahmed. Let us review from the beginning. Ahmed, I know this is a difficult station in whole MRCS OSCE examination. This cranial nerve examination and the hand examination, the time didn't allow you to complete your examination. You stopped in the cranial nerve 8, which is vestibulocochlear nerve. But you, from the beginning, you introduced yourself, you took the permission, you start by the cranial nerve 1, very nice. And then the visual acuity, Ahmed. Regarding the visual acuity, you forgot the can you please? I would like to flashlight in your eyes. Torch.
Yes,
torch.
yes. I
Yeah.
forgot that.
Yeah, and the point regarding moving your hands, like, could you please tell me?
Wiggling.
Yes. Can you see it? When you see it, tell me. You know?
Okay.
Yeah. Because this is an important thing. You did something regarding vision. You asked me to read something in your book. What's that test?
No, not something in your book, but I did want to lose time. But
What's
it
this
is
test? We didn't
for
wrote
color,
this in
for
the
color,
school.
for color. No, in school, for color. But
the-
you will say a color chart, but you must say skip it.
Okay. And you did the cranial
I see
nerve
it in the
3 and
video.
4 and 5, oculomotor tracheal abduction, very nice by H shape. And the trigeminal, in the trigeminal, you forgot to ask me to resist you when you pushing my jaw against direction. Okay. Hello. Internet connection.
Muhammad,
Yeah, Ali. I'm really sorry.
what happened?
I lost my internet
Yes,
connection.
let me just continue. So you flash the light, you do the edge movement, you make sure that you take the acuity quickly. Fundoscopy, the examiner will ask you to skip it. So if you notice, most of the examination is within the eye. So you should
Yes.
finish the eye fast so you can finish the rest. And to be honest, the last nerve examination are very simple. You just ask the patient to say to examine the vagus and then shrug your head.
Yes.
You can do this in 20 seconds.
Yes.
Yeah, so that's why you need to be fast in the eye. Your performance is fantastic.
Okay.
Nobody expects you to finish all the cranial nerve. Usually it's gonna be bitemporal hemanopia, and you need to figure it out, or it could be tympanic membrane perforation. These are the two scenarios. There's a third one, Muhammad, right?
Yeah,
You said
both of them whole
Yeah.
cranial nerve. One of them
Yes.
ear and cranial nerve 7 and 8.
Okay. The only grammatical mistake you said we will start by check. You should say I will start by checking, right? Not by check.
Okay.
Yeah, I will start by checking this or I will start by checking that. Muhammad, continue what you were saying. We just say, yeah, he did a very good performance. Very nice, Ahmed.
Thank you, Mr. Ali.
Yeah, I'm so happy that you explained to your patient the tonic fork, which create a vibration, but I am also didn't allow you to do the Renin and Weber test. And the last thing, I need to remember it, but I can't. Yeah, facial nerve.
Did you examine the facial nerve, Ahmed?
Yeah, he did that,
Yes.
Ali, but the time didn't allow you to continue the vestibulocochlear nerve. You
So
should-
Muhammad, let's be logical. Let's be logical. If we want to finish all this station within 6 minutes, we have to omit some of the eye examination. To be honest, because the eye has a lot of examination: visual acuity, pupil reflex, and you have oculomotor, trochlear, abducent.
Ali,
So
the
yes.
most common station came in the previous exam, which is the ear examination plus cranial nerve 7 and 8. Rarely all the cranial nerve come in the exam. Or the examiner may ask you to do the cranial nerve 1, 3, 7, 6, what he choose. He will not ask you to do all the cranial nerve, but you should train yourself to do it all.
Okay.
Yes. Also, Ahmed, I noticed you every steps you need to do, you took permission from me. Why? I would like to flashlight, okay? I would like to, okay. Just
Yes,
say,
Muhammad, that's the right thing to do.
Ali, not permission from everything. You took the permission from the beginning, but you should say to me, I would like to flashlight in your eyes. And then flashlight immediately. I would like you, I will spare a sound. Could you tell me the number? Not
Yes,
okay.
Yes, okay. I just wanna make sure the message is very clear to Ahmed. So you took a permission from the start. All right?
Yes.
You need to tell your patient what you're gonna do next. That's fine. But instead of saying I would like to flash a light, is that okay? There's no need to say is that okay. You should tell your patient what you're gonna do, but you shouldn't take permission every single time.
It will take from you 10 seconds to say yes.
Yes.
Do you understand, Ahmed?
Yes, I understood.
We are not saying you shouldn't tell your patient. You should tell your patient, I'm gonna flash a light, I'm gonna do that, I'm gonna do that. But don't say is that okay, is that okay, is that okay, is that okay, is that okay.
Okay.
Otherwise, you did very good, nice, Ahmed, and you answered all the question of discussion correctly.
I think Ahmed gets most of the difficult station all the time.
Yes.
Cranial nerve okay, we have 3 minutes, Muhammad. I can see, guys, in the school, most of the previous videos are not uploaded. Why didn't you ask for it?
Ali, we uploaded in the group.
No, I mean in the school. In the school, it's not uploaded, Muhammad.
There is only two sessions. We didn't
No,
upload it.
the abdominal examination.
I collected in one videos.
No. There's 3 or 4 sessions that's not uploaded. We're gonna upload them today.
No, Ali, not 3 or 4.
No, check.
Yeah, I check it. I follow it every day. We have 2 sessions.
Let me open it now. Just bear with me 1 second.